I'm
Let's
ready
do
if
it.
you are.
All right, cool. Looks like we've got a good number of attendees here, so I think folks will keep trickling in, but appreciate everybody joining us today. Welcome to Healthcare Options in Early Retirement. Healthcare and early retirement is a huge piece of the whole planning puzzle, so I'm glad that we've got Lyndia Cunningham, who's our expert here, to join us. This webinar is being recorded, so don't worry about taking notes. We can always send out the recording for you afterwards. But what we'll do is we'll start off with a quick introduction from myself, Cody, and Lyndia, and then we will jump right into it and start talking about the healthcare options for early retirement. So quick intro for myself. My name is Alan Mueller. I run a financial planning firm called 7 Saturdays Financial based out of Dallas, Texas, and I help aerospace and tech professionals on their path to early retirement. So go ahead, Cody, talk about you and your company a little bit.
Yeah, so my name is Cody Lachner. I am the founder of Next Adventure Financial. It's a fee-only financial planning firm serving folks approaching retirement, primarily working with those in the early retirement space there. So I'm based in Lafayette, Indiana, but I serve folks across the country.
Cool. Thanks, Cody. And then Lyndia is our healthcare expert here today, so I'll let her do a quick intro.
Hi, I'm Lyndia Cunningham. I work for Move Health Partners. I do both pre-65 and Medicare health insurance. I've actually been in the space for about 7 years now. So I am super excited to be here and share some of the knowledge that I have with all of you.
Thanks, Lyndia. A couple of housekeeping items before we get started here. If you guys have any questions, just please put those in the Q&A. You can get to that on the bottom screen of your Zoom bar. So just type those out and we'll make sure we leave 15-20 minutes at the end. Try to get through as many questions as we can. And then just a quick disclaimer. So nothing in this presentation is financial, tax, legal, relationship, any type of advice specific to your situation. So please run all those things by your CPA, your financial planner, etc. So at this point, I'll just turn it over to Lyndia and she'll walk us through the presentation.
So this is something that we hear very, very often is, hey, my financial advisor says I'm ready to retire, but I don't know what I'm going to do about health insurance. I don't know if it's going to be affordable for us. You know, everything that we've seen from everyone else has said, hey, it's going to be $2,000 a month. What do I do before I turn 65? This is actually really kind of aimed more towards the financial advisor, but it's really important that everyone knows that a lot of people are noticing, hey, I'm terrified of what my healthcare costs are going to be. There have been a ton of Americans who've said, I don't even know if I can estimate what my healthcare costs would be, especially based off what people say Cobra costs are, or just having absolutely no knowledge at all. So 72% of people recently had said, if my financial professional can't help me with these things, I would likely switch to someone who could. So that's how we partner with financial advisors like Alan and Cody to help their clients look at what their options could potentially be for early retirement. We will kind of start here with retiree benefits. So depending on how long you've been at an employer, you could be offered retiree packages where they do give you your health care, typically at a lower cost. Some of the times this is the lowest cost option available to consumers. So it's something that we consider and we have in our tool belt when we are looking at what options are available. It usually is an earned benefit. You usually have to be with a specific company for a tenured amount of time before you can qualify for the retiree benefits. But one of the things that we are learning and coming across is that these packages are becoming skinnier. They're having higher deductibles, they're having more narrow networks, and the cost of these plans are just getting higher and higher. So that's kind of what helps us look at some other options besides the retiree benefits. Another option is Cobra, the Consolidated Omnibus Budget Reconciliation Act. A lot of people don't really realize what Cobra is. They think that it's own separate plan. But what Cobra is it is just a continuation of the coverage that you were already receiving from an employer. So we look at this option more heavily if we are talking to someone who has a health condition. Maybe that's making them retire early. So they've met their deductibles or their maximum out of pockets on their current plan, because Cobra is just going to continue that plan on for them for the rest of the plan year. But some of the downsides of Cobra is it's really expensive. You're typically looking at $1,500 to $2,000 a month to carry on your current coverage, because what happens with Cobra is you're taking on the responsibility of not only what you've been paying for the coverage the entire time, but what your employer has been paying for that coverage, as well as a 2% surcharge. So it's still something that we keep in the tool belt for consideration, but it's not really the most common route that people tend to take. Another option that's available in the individual market for those that are not yet 65 is something called term major medical. This is a really good option for healthy individuals because they don't cover any pre-existing health conditions. They don't typically cover prescriptions. They don't really cover pregnancy. These are what we like to call your catastrophic worst case scenario safety net style plans. This is something that we would have someone put in place if they are really just trying to get from point A to point B, maybe 3 months of coverage or sometimes a year. People who maybe have higher incomes, but they're really healthy, we'll put them in these plans for who we like to call the young and invincible. So we will put people who are in their 20s, who have no health conditions and have absolutely no outcast of any health conditions in their futures, because they're really just there to act as kind of a safety net against those worst case scenario style things. Alan or Cody, do you have any questions so far?
Yeah, I was kind of curious about the medical underwriting. Do you see those plans get denied pretty often, or do they just raise the cost based on those results?
They absolutely can be. So they won't raise cost based on those results for most of the term major medical carriers. They'll just outright deny you, and they will actually deny you for some of the most silly things. If you've had physical therapy in the last year, if you've taken certain medications that are on knockout list, there's a lot of reasons that they will just absolutely deny you coverage. And as you can see kind of in the cons, they don't cover pregnancy. So if you're pregnant, they're going to deny you. Some carriers will actually not cover you if your spouse is pregnant, which is really strange. So there's a lot of restrictions and a lot of red hoops that you have to jump through to even be qualified for term major medical.
What are the typical term lengths on these types of policies?
It is state-based, so it really depends on the state that you live in. So currently, I'm in Indiana. In Indiana, you can do 36 months of short-term, but in states like Pennsylvania, Virginia, you can actually only do 90 days of consecutive coverage, and they tend to have some stops on when you can enroll. Like Virginia will not allow you to enroll in a short-term major medical plan during the open enrollment period for the Affordable Care Act. It's kind of their way of trying to push people back into that option and lower down costs for everyone else.
So it sounds like at some point with these major medical policies, people essentially get kicked off and they have to just find another option anyway.
That's absolutely correct. And one of the things that's always concerned me as an agent is putting someone in a major medical plan and a health condition happen while they are in that plan. And then their plan terms, and we're outside of an enrollment period for any kind of coverage that would cover that pre-existing condition or carry them at all at that point. All right, I'm going to move on to another option. So this option, healthcare sharing, is actually becoming increasingly popular. We actually work with a healthcare sharing program called Medicare here at Move Health. The reason we choose to work with Medicare is it works the most like traditional health insurance, and they've been around for over 30 years. So very financially stable company. They've got a really long history. And some of the benefits of the healthcare sharing is really cost. The healthcare sharing programs are a lot less expensive than some of the other options on the market if you don't qualify for any kind of savings or anything through the ACA. But they're a little different. The biggest pro for me with healthcare sharing is usually network. They are typically PPOs. So if you are a retiree who plans on traveling, if you're going to be all over the US, this is a really great option for that. Another big reason is because they have lower out-of-pocket amounts. Medicare specifically offers as low as $3,000 annually at half the cost of some of the other competitor options that are out there. One of the big things with them as well, though, they don't share in the cost of pre-existing health conditions. Medicare specifically won't share in the cost of those for 36 months. So if you're 62 and you have a pre-existing condition, not necessarily going to help you, because by the time they would kick in to help share with that, you're going to already be on Medicare.
All right, lots to unpack there, I think, Lyndia. One of the things you mentioned was, if you're going to be traveling a lot, maybe the PPO is the better plan type. Can you talk a little bit about that versus what the other options are?
Yeah, absolutely. So there are several different plan types. The PPO is one of them. It's a preferred provider organization. With a PPO network, you get both in-network and out-of-network benefits. So that means that if you wanted to see a doctor that doesn't necessarily accept the plan, you can. You typically have higher rates if they're not within the network, because you're not going to get that network negotiated rate, but you still have that opportunity of seeing them and all of the costs that are incurred with them going towards your out-of-pocket with that plan. You also have something called an HMO. HMOs have no out-of-network benefits. So with an HMO, you have to see an in-network doctor. If you were to see a doctor that does not accept the plan that you are in, it would not go towards your deductible. It would not go towards your out-of-pocket maximum. It would essentially be completely out of pocket to you. HMOs also require that you get a referral to see a specialist from your primary care physician. So you would have to go to your primary care and say, hey, my foot's acting up. I need to go and see a podiatrist. And they would have to send that recommendation over to the podiatrist on your behalf, making sure that that podiatrist is in network. Another option is an EPO, which is an exclusive provider organization. EPO is very similar to the HMO in the fact that you have to stay in network. You don't get any out-of-network benefits at all. You have to make sure the doctors accept the plan. The only difference is you don't have to have a referral to see a specialist with an EPO. So you can go and see a foot doctor without going to primary care physician first.
And Lyndia, one question I had about health sharing plans. So one of the biggest things to be aware of is, and you've got it noted on the con section there, but it is not insurance. So one of the fears I've had come up in the past in conversations is like, well, a health sharing organization could potentially deny my claim or my request for, care. So like, how likely is it that something could be denied? And is there a way for, consumers to find that information out ahead of time before committing to going in on a health sharing plan?
Yeah, absolutely. That's a really good question. I always say, do your research. Absolutely do your research on any carrier that you are looking at. I can only speak on behalf of Medishare. And what I know about Medishare is they are very, very clear in what they will pay for and what they will not pay for. They have a full guidelines that says, hey, these are the services that we deem shareable. These are the services that are not. For example, pre-existing health conditions. They deem a pre-existing health condition anything that you have received treatment for in the 36 months prior to joining Medishare. So that could even be if you were a cancer survivor 20 years ago, but you're still getting your annual exams just to make sure, or you're every 5 years, that's still considered treatment for that condition. So if it were to come back up in that first 36 months, you remember, they're not going to share in the cost of it. I also always kind of combat it by saying, the big thing is, well, we're not insurance, so we are not legally bound to pay your bills. Even insurance companies aren't necessarily legally bound to do so. So if you are drinking and driving and you wreck your car, neither your health insurance or your car insurance are going to pay for those bills because you're doing something illegal. There's a very similar circumstance with Medishare where they say, if you are doing these things that we say that we will not share in the cost of, we're not going to. It's very much black and white. So always do your research and always read the fine print.
That's great. Thank you, Lyndia. One other question I had about that is I've heard that some of the health sharing plans, they require like you to profess a certain religious belief or to abstain from certain lifestyle practices. Have you come across that? And what are the kind of some of the common qualifiers there?
I absolutely have. And these are one of those things that everyone, I think, learns the hard way in my first year. I did learn some things about the healthcare sharing, especially Medishare. So you do have to agree to live a Christian lifestyle. For that, it is 5 quotes out of the Bible that you have to agree to, but you also have to agree not to partake in tobacco, not to drink heavily. If you are not married, you cannot be in the plan together, you and your significant other. If you are not Christian, specifically with Medishare, so if someone who is Jewish for example, would not be able to join something like Medicare because it's not a Christian faith. One of the things that I come across is young females. I will tend not to really push Medicare on young females because if something happens that you were to get pregnant, that would be considered pregnancy out of wedlock, another thing that Medicare will not pay for. And then the big one that I even hate to say is same-sex couples. Medicare is not a good option for same-sex couples. They just do not recognize that.
All right, thank you. Cody, have you come across these healthcare sharing plans with most of your clients, or is that something that's not very common?
This was something that I think was a little bit more common with my clients. I mean, years and years ago. It's not so common anymore. And I know one of the other options we're going to talk about here more extensively is like the Affordable Care Act. I think that's been a much more common theme among my clients and some of the planning that I do. How about on your end?
Yeah, not really. Usually the Affordable Care Act is kind of the elephant in the room for for these types of situations. So I have heard, kind of peripherally about these healthcare sharing plans, but haven't really dug into them in detail. So I'm glad Lyndia's answering these questions.
Yeah, a big thing too, when I started several years ago, these were a good option because they were exempt from the Affordable Care Act penalty that there used to be, where if you did not carry Affordable Care Act compliant coverage, you were penalized on your taxes. This was exempt from that because it was religious. And so a lot of people who were healthy didn't want to spend the high premiums on the Affordable Care Act way back when. And so this was an option that helped them avoid that penalty. We don't currently have that, but there is potential that that could come back, especially under our current administration, because they are wanting to drive as many people back into the Affordable Care Act as possible.
That's great detail to add. Thank you.
And then on that note, the Affordable Care Act marketplace. This is a huge option for the early retiree, especially in the last several years. Back in 2019 and previous to that, people with somewhat higher incomes just didn't qualify for any of the savings through the Affordable Care Act. So they were a little expensive. But there are some things that happened since COVID that have made it to where more and more individuals qualify for some assistance in this regard, driving down this cost substantially and making it an amazing option for people who are looking to retire early. So one of the big things with the Affordable Care Act that's really important to note is that they have to cover all 10 essential health benefits. All the Affordable Care Act is a law that went into place stating that health insurance companies could not rate you up or deny you based on health conditions you already have or just for any other reason. The only thing that they can rate you on is your location, what your age is, and whether you're a smoker or not. That's it. So that really has kind of helped make it to where people who couldn't retire early because maybe they had type 2 diabetes or something minor, they couldn't retire early before because they did not have a health insurance option that was available to them. So when the Affordable Care Act went into place, it made it possible for people to have coverage outside of employers or outside of Cobra's high cost, or not having to work until they were 70 just to afford their health insurance coverage. So because of that law, other options, like we discussed before, they decided they didn't have to cover any of those things because we now have this option that by law has to cover pre-existing health conditions, no matter what, give you free preventive care. So your physicals, your immunizations, your colonoscopies, mammograms, all of those good things have to be free by law. They also have to cover prescriptions. They have to cover pregnancy. They have to cover mental health. They have to cover ambulatory care. They essentially cover all of the things that are really important to most people. The Affordable Care Act marketplace plans are what you're most used to if you've got coverage through an employer currently, because they are also bound by the Affordable Care Act law. So it's usually a little bit easier of a transition for people than some of the other options because it is what they're used to. One of the great things too is that we do have all of these extended subsidies in place. What a subsidy is it is an amount that the federal government gives to you to help offset the cost of your premium based on what your modified adjusted gross income is for your taxable household. Before, you didn't have a very high threshold. Whenever 2019, I believe it was 55,000 for a household of two. If you made more than 55,000, you were paying full cost for these plans. They were a little bit ridiculous in cost back then. They have actually removed that cap on income, which is what is making this such an amazing and viable option for the early retiree. In some places, people who are 63 years old and make $200,000 a year as a married couple are still qualifying for some sort of help paying for their premiums through the Affordable Care Act.
And we should add too that those subsidies do not look at assets. It is purely looking at that modified adjusted gross income.
Yep, that's exactly right. And that's what makes this so special is they are looking at taxable income as well as adding back in some things like Social Security, some foreign income, but they're not looking at what you have in your savings. They're not looking at what assets that you have. They are looking at what your taxable income is for the year in which you are seeking coverage. So they are looking at right here, right now. Sometimes we look at this like massaging that modified adjusted gross income to help make those premiums even lower. So sometimes someone will come to me and say, well, I want to retire in July, but they've got $200,000 already of earned income for that year, even though it's only halfway through the year. So that's where we'll talk about, well, let's look at retiring at the end of the year. And then that way we only have to take next year's income into consideration when shopping for coverage. Now, I'll kind of go here.
Lyndia, could you go back to Cobra? Because on the topic of talking about like costs, one little tip I wanted to add was specifically, I've had this question come up with clients and other people, but with Cobra, it's like the question that comes up is like, how do we estimate the cost of that? We know it's going to be expensive, but how do we estimate the cost? And one of the best ways that I found to at least get a rough estimate is to look at your last year W-2. And you can find box, I believe it's box 12, code DD, and that will tell you your total cost of insurance for the prior year. So, Lyndia, I think you mentioned they can, with the Cobra cost, they can tack on an additional administrative cost. So that's like capped, I think, at what, 2%?
Typically.
So you could take that number in box 12, code DD, multiply that by 1.02, and that can kind of give you a very rough idea of what it might cost. But obviously those costs change year over year as well.
Yeah, and typically you can go to benefits administrator as well and say, hey, I just want to know what the cost of Cobra would be just out of curiosity. They are typically bound by HIPAA, so they can't really go around saying, well, so-and-so is asking about Cobra, they may be leaving. And so that gives you kind of a safe space to ask for those numbers as well.
Yeah, perfect.
They're usually not low. They're usually absolutely absurd.
Oh, yeah.
Absolutely. Even in all of my years of doing this, sometimes I'm still surprised. And so I was like, yeah, it's $2,500 a month for a $6,000 deductible.
That's it.
What? Okay, well, let's talk about the Affordable Care Act and what options can be available to you there. Now, I know we kind of touched on some of the pros and some of the things that the Affordable Care Act does. It is really important to know that there are also restrictions with the Affordable Care Act. They are typically HMOs or EPOs. I know we kind of discussed those different networks earlier. It's really rare through the Affordable Care Act marketplace to find a PPO network, and that is just the way it is in most states. There are very few areas that are really rural that you will find PPOs because they realize that you're not going to be able to find all of the doctors that you need in your rural areas. So there's a lot of places in Illinois and some other places out there that you'll find a PPO every now and then. But really, we are with that HMO or that EPO, sometimes a POS, which is a point of sale, but also very rare. What that really means for the early retiree and why that's important is that the plans through the Affordable Care Act marketplace will only work in the state that you live in unless it is a life-threatening medical emergency. So if you're relatively healthy and you're planning on traveling a lot, we may want to look at other options or just something secondary for you, because it's not going to help you with the sniffles or cold or anything minor if you are out of state. Now, if you end up in the emergency room because you've broken a bone or because you're having some type of life-threatening medical emergency, they have to accept your plan out of network as if it's in network. But if you have anything, poison ivy, whatever it may be, Affordable Care Act plan's not going to work. We do typically try to pair those plans with a telephone doctor benefit or something that will work for you nationwide on those small things like that.
Is that, you mentioned kind of those standalone plans. Are those like typically just rough cost for like a teledoc plan? This is the first time hearing about an option like that.
They're usually about $20 a month. We actually have one that's included in an accident and critical illness coverage, which we typically add, that gives you $10,000 if you are diagnosed with critical illness, if you have a major accident. It's going to help with offsetting the cost of deductibles and maximums. It's typically included in that plan. For a single individual, that plan is about $34. But if you wanted to just have a telephone doctor, it's typically about $20.
So with that telephone doctor, so let's say somebody comes down with some sickness that requires like medication and they have a conversation with the telehealth. I assume that would allow the person to, like, if they needed a prescription, the telephone doctor could call that in wherever they're at. If they're traveling, they can call it in and pick that up. Is that correct?
That's exactly right. And that's one of the things that we love so much about that plan. One of our co-founders here always likes to tell us about how he was taking his kid to Florida. His kid got an ear infection, pulled off on the side of the road, called the teledoc. Hey, it's an ear infection. I know that's what it is. He gets them all the time. They called in an amoxicillin to the nearest pharmacy to them, and they were able to just zip over there and pick it up. It also can work for minor prescription refills. So if you have high blood pressure and you are out traveling and you need a refill, you can usually get those kind of things refilled. It would just be controlled substances that they will not call in a refill for you.
That's really good info.
Good question. Yeah. All right. Some of the really important things to know about the Affordable Care Act and those subsidies. The subsidies are technically called advanced premium tax credits. The reason that they are called advanced premium tax credits is because the federal government is going to send whatever amount that they determine you're eligible for directly to the carrier of your choosing. So you don't have to mess with getting that at any point later and having to figure it out. It's going to automatically come off the cost of your premium monthly, go right over to those carriers. But there are some different things to be able to be qualified for them. In order to be qualified for those subsidies, you cannot have coverage offered to you elsewhere. So whether that's through your employer, whether that's through your spouse's employer, whether that's through Medicare for those over 65, or whether that is for people who are on Medicaid, which is for very low income or pregnant females or children. No tax credits are given to anyone who qualifies for any kind of coverage that is deemed Affordable Care Act compliant outside of the Affordable Care Act marketplace. So that's really, really important. There are some caveats there. There are some laws around spouses coverage. If a coverage is deemed unaffordable for a spouse, then we can potentially look at getting subsidies. But for the most part, we just say golden rule. If you've got coverage through an employer, you don't necessarily qualify. As I was saying earlier, they automatically reduce your monthly and health insurance premiums immediately. So I know I always get that question. They're like, well, what do I do with it? Is this the cost pre or post? The cost that I give people when I'm talking to them is after those Affordable Care Act advanced premium tax credits are already applied to your premium. Like I said, going right directly to the carrier of your choosing. That's a big one too. You can only get the advanced premium tax credits for plans that are offered through the Affordable Care Act marketplace. So most people know this is healthcare.gov. You have to purchase your policy through healthcare.gov to be able to apply those tax credits. Some people will ask me, well, what if I went directly to Blue Cross Blue Shield, or if I went directly to Anthem or whatever it may be to purchase coverage through them? You can do that. They don't have any different or other better plans that are available. You would just be paying full price for those plans through those carriers. And then, like we were saying before, it's based on the year in which you are receiving coverage. So they're not going to look and see, hey, well, this person made $300,000 last year, so we're going to rate them up. It is all based off of the year that we are currently in. So if you are looking for coverage to start in May, they're going to be looking at your full modified adjusted gross income from January 1st of this year to December 31st of this year, and that's it. And so when we are looking at renewing coverage annually during the open enrollment period, which is in November, we're actually projecting and we are looking into the following year to say, hey, what is your income going to be next year? You know, we need to really give it our best guess. We do try to guess a little higher than average just in case, because there are some ramifications if we do put the wrong income on the application.
Yeah, I think that's a big misconception about, you know, seeking or estimating magi for the year that you're seeking coverage. Like, I can't tell you how many times people think that, well, I made too much money last year or 2 years ago. They think it's kind of like Irma with Medicare, but yeah, I'm glad you answered that.
Yeah.
And the healthcare website does have a really cool tool. So if you are kind of thinking about retirement, within the next year or so, you can go to the healthcare.gov website, and they have a little tool you can kind of like type in your zip code and just hypothetically act like you're going to be applying for insurance. So you're going to tell them about your family, your age. You can do the income estimate, and it's going to tell you right off the bat roughly, what your tax credits might look like, and then what plans are available in your area. And I really like the tool too, because like you can actually get behind the scenes and kind of filter based on doctors and prescriptions and really weed out plans that don't fit, your situation. So you'll know exactly what you're sort of walking into.
Absolutely. My piece of advice on that, though, is no matter what you do not put your phone number into that site. Don't do it.
Yeah.
You'll be really upset if you do, because you're going to get about 500 phone calls in 30 seconds.
Kind of like getting quotes for home and auto insurance online.
And honestly, I think sometimes worse. I think they recycle that for years too, no matter what you do, because essentially what happens when you go on these sites is they sell that information to companies all over the United States. And so you will have automatic calls from every agent in the US as soon as you put your phone number in there. So don't do that. That's my biggest piece of advice. And I know we kind of already touched on the American Rescue Plan, giving us all of these extended tax subsidies. And so it really is important, to go and check it out. Go to healthcare.gov. It's healthcare.gov/C plans is usually the easiest way to get there. Put in your income, put in whatever. You can mess with it. You can say, well, can I survive on, XYZ, 100,000? Well, can I do 120? And just kind of look at some of the plans there. I will say, sometimes there's a bit of sticker shock, because another one of those things that we have to kind of work around with the Affordable Care Act is if you have a higher income, you're going to have a high maximum out of pocket on your plan. There really are no plans available for the higher income levels that have less than 7,000 out of pocket max per person. It's just the way the market is right now. We do look at whatever it is we can do to offset those costs, like whether it's looking at accident critical illness coverage or whatever it may be. But just prepare yourself. If you're over $35,000 a year in gross income, you're most likely going to have a $7,000 out-of-pocket maximum, at least. Kind of same thing here. So right now, when they removed a part of the American Rescue Act is when they removed that income cliff, because that's what we used to call it. Essentially, if you make more than 60,000, you get no subsidy. You're falling off that income cliff. You're paying full cost for these Affordable Care Act plans with high deductibles and high premiums. If you're 55, 60, 62 years old, you're looking at $1,000 a month full cost and still having an $8,000 deductible. And that was just kind of the way it was. Hey, you make 60,000. You don't qualify. You're probably better off going on Cobra or looking for other options or working until you're 65. As a part of the American Rescue Plan Act that went into place to help with COVID, that restriction was removed. So instead of having this hard stop at $60,000, they've made it to where your plan cannot cost more than 8.5% of your annual income. And the plan they're looking at is the second level silver plan that's available in your area. They look at that calculation. If the plan is more than your income, then they're going to make it down to where it's 8.5%. And the difference is what your subsidy is. So the lower your income is, essentially, the less you pay for coverage as a whole, because the 8.5% is really at that income cliff. But if you make 50% or $50,000 a year, you're going to most likely be looking at 6% of your income. If you make 30, you're going to be looking at 4% of your income that you're paying. It makes it really easy to come up with a quick estimate of what your potential healthcare costs would be. Because if you're making $100,000 a year, most likely you're looking at $8,500 a year in premium. And it kind of gives you a little jumping point to know exactly how those are going to get calculated.
Yeah, that's a great tool to estimate it. We did have a question, since we're talking about it, the cliff for the income or for the tax credit subsidies, that is back in 2026 per current law. So the law that suspended it for a couple of years, and basically the way that cliff works is you could earn another dollar, like $1 above the cliff, and you could lose thousands of dollars in tax credits. So, hopefully they do it more like a sliding scale or a phase out. They passed some legislation that extends it past 2026, but as far as now, that's how the law is written.
That's what we're really hoping happens. We're really hoping that they just extend these, because the ultimate goal was always to get as many people into the Affordable Care Act as possible, because the more healthy people that you have in these plans, the less expensive that they are going to be overall. So the goal has always been get as many healthy people into the Affordable Care Act as we possibly can, drive down those costs. So we're really hoping that they extend them. But right now, what we know is they're at least guaranteed through 2025. So this is the perfect time for early retirement.
And Lyndia, I saw we did have another question. This kind of goes back to some of the basics on the Affordable Care Act, but somebody asked if somebody has ACA coverage, they're on a family plan, and one of their children are attending college in another state, are they covered?
That one's a rough one. So we typically, if it is possible for the child to be on their own plan, that's what we would look at. But they would also have to have a minimum taxable income if that was the case, and they would have to file taxes on their own. Because in order to carry your child under you and receive tax credits for that child, you have to file them on your taxes. So if they're able to claim themselves on their taxes, they have a high enough income, we would usually recommend that. A lot of times we will look at those major medical plans as well, especially if they're healthy, because that would at least cover them out of state. It give them that PPO network. We also will try to consider if they have options available to them through the college, because a lot of times, depending on what they're going to school for, where they're going to school, there are options available there as well for them. Another thing we would take into consideration, but really the big answer is no, not unless they have a life-threatening medical emergency and they end up in the emergency room. It's not going to help with any of their preventive care or any of their just minor things that they're going to a doctor for.
So one of the financial planning considerations of this whole thing is, engineering your MAGI to be low so that you can get the maximum tax credits possible, which reduces your premium cost as you bridge to Medicare. So I'm sure that's something that Cody sees all the time. I've seen it a lot where, we really have to incorporate into the overall financial plan because, are we going to pull from our Roth IRAs instead of our traditional IRAs to keep that income down? Are we going to, pull from our savings, our cash buffer, right? Because that's not taxable income. There's different levers that you can pull, but everything has a trade-off, right? So we're probably not going to be doing heavy Roth conversions in those years when you're trying to qualify for the premium tax credits. So, if that's the case, is there enough time between Medicare age 65 to RMDs starting at 60 or at 73 or 75, depending on the person's age? So, everything has a trade-off. You can't really just go into it with one objective, like keep my taxable income as low as possible, because that can backfire on you in the long run. Cody, what's been your experience with that?
Yeah, so I don't know, with all this stuff, I always say it's as clear as mud. And I think you kind of covered that well, is there's always trade-offs. And one way of approaching it, we kind of see like what level of premium fits the best in, the overall retirement plan, and then kind of work from that number. But one of the questions which I'm sure you get all the time is like, well, if I'm engineering my income and I'm keeping it super low and I'm finding myself in a super low tax bracket, like, shouldn't I do Roth conversions, and shouldn't I like willingly pay some tax on it? And it does get kind of muddy when you start to think about, well, like, what would it look like in lost subsidies, plus the additional income tax? So you kind of have to take that analysis a little bit further, to see, realizing or recognizing additional income, like what does that actually look like in terms of your marginal tax bracket, those lost subsidies, your actual marginal, your normal ordinary marginal tax bracket. You kind of have to look at all that stuff. So it's definitely person to person, and it really just kind of starting with that financial plan to see what works best.
It is incredibly individualized. And that's sometimes one of those situations where we're like, well, if you're wanting to do a lot of conversions this year, maybe for the remainder of this year, take Cobra. And then we can talk during the Affordable Care Act open enrollment about what your options would look like next year with a lower income.
Yeah, that was the other thought I had too, is, talking about like the health sharing plans. If it's somebody that maybe they just don't have the ability to get their taxable income or their adjusted gross income low enough, Maybe that's an idea as well. Look, like you said, looking at Cobra, looking at health sharing plans that don't have these income restrictions, and then kind of going from there.
We always do a review, always. And I think that's super important. Even if you are talking to an insurance agent that isn't me, it's always important to say, hey, I want to review my coverage annually, because what fits me now may not fit me in 2025 or 2026. And a lot of people get that misrepresentation that, hey, you can be in this plan and it's just going to be it. It's going to work for you. We used to have grandfathered Affordable Care Act plans before all of this kind of went into place, where people are paying $2,200 a month for terrible coverage because they thought that that was what I needed. I needed to stay in. So it's always a good idea to do a review of your coverage every fall during the open enrollment period and the annual election period.
Yeah, that's great advice. One of the things that kind of my mind goes to when I see that table at the top is like, well, what about all the way over on the left? What if we just keep Magi super low and we go on Medicaid? Like, what does that look like as far as, the ACA versus not? How do you explain that, Lyndia?
I try to do everything in my power to at least get that income to the threshold not to be sent to Medicaid. Medicaid is really, really great for children under 18. It is really great for pregnant women. But every state has its own guidelines regarding Medicaid, because Medicaid is a state-funded health insurance program. So where one state, such as Indiana, may allow adults in Medicaid, they may allow you to have your children in Medicaid until they're 23. We have some different restrictions here. Other states like Florida, they don't do adult Medicaid at all. Unless you are disabled and you've been on disability for 2 years, they will not cover you for Medicaid if you're an adult unless you are pregnant. So there's some different qualifications there. There's also that income thing. So where the Affordable Care Act marketplace is looking at taxable income, when you're looking at Medicaid, they're taking all of your income into consideration. They are looking at your assets. They are looking at if you own more than one home or more than one vehicle. They are taking all of that into consideration. And so if we put the income too low on the federal marketplace app, they're going to automatically kick you to Medicaid, no matter what. They don't care what those state guidelines are. They do not care. They're going to say, hey, if we don't have to pay for your health insurance coverage and somebody else can do it, we're going to have them do it. And so it gets you kind of stuck in this perpetual loop where, like, if you are somewhere like Florida and you don't actually qualify for Medicaid, you're also still showing you don't qualify for any of these tax subsidies through the marketplace. So we truly try to keep it at least at that minimum, the very best that we can. You can actually overestimate your income on the application as well to avoid that. There are no penalties for making less money than what we put in your application. There is no, well, hey, you should have had Medicaid, so we're taking all of this back from you. And so we can fluff it a little. If we fluffed it too much, they're going to raise a red flag and say, well, in previous years, your income was not that high. But we can massage it a little bit higher to avoid that threshold. And the same goes for the other direction. A question I get a lot is, what if I miscalculate? What if I put my income in there too low and I end up making twice as much? One, always update your advisor, your health plan advisor, anytime you feel like there's going to be an update to your income. So if you are on the Affordable Care Act and we've already filled out your application and submitted it, you can still update income all year round. So you win the lottery in July, give your health plan advisor a call, let them know. And what it does is it adjusts your costs for the following month going forward. If you don't have time to do that, or you just don't realize that you're going to make more, essentially what happens is that in January of every year, the Affordable Care Act Marketplace mails you something called a 1095-A. This is very similar to your 1095-B that you receive from your employer that you file with your taxes. This document is going to show the federal government via your taxes the subsidy that you received versus the subsidy that you should have received based on what your actual income is. And so if we put $50,000 income in here, they're giving you $1,000 a month in subsidy, but you made $75,000. Maybe you would have only qualified for $600 a month in subsidy. So you're going to have to pay that $400 difference back for every month you had coverage. You have it for 12 months. You're looking at over $4,000 that you're going to owe to the federal government. Works the other way too. If we put $75,000 on the application, you end up only making $50,000. The federal government is going to give that $400 a month back to you.
Does that also have penalties? Like, with your taxes, there's underpayment penalties. Is that the case with the premium tax credits as well?
It is not. They're just going to have you pay whatever that difference is.
Gotcha.
Good question. Is there anything that we're missing?
One question I had was, the ACA plans, they can vary tremendously from state to state. Are there any states that, the ACA or the marketplace plans are just so unfavorable that you recommend other options to folks, or are they all pretty workable around the country?
They're pretty workable. I mean, it's all based on zip code. So depending on what zip code you're in, it will let you know what carriers you have available to you in those zip codes. When we're looking at carriers, we are taking that into consideration. Like, are they a terrible carrier? Do they only have 1 or 2 stars? We're probably not going to put you in that one. But we have to take into consideration doctors, because as we know with the Affordable Care Act, you have to stick with a carrier that your doctors are in network with, or you're paying out of pocket for it. So we're looking at carriers, we're looking at medications. You want to take all of those things into consideration when you're shopping for coverage. It's pretty even across the keel. There are a few states that are state-based marketplaces now. They are no longer a part of the federal marketplace. They've decided, hey, we can handle this on our own at a state level. There are states like Kentucky and Pennsylvania and some other ones here and there. It's a little harder for coverage in those states because they're being administered by the state as opposed to by the federal government, but it doesn't necessarily affect the level of coverage in which you receive.
We did have another question about similarly related to states. So somebody was asking if you move between states during the year, is that a qualifying event where you can re-enroll in the new state, or how does that work?
It absolutely is, and you 100% should do so, because if you are living in Texas and you're moving to North Carolina, your Texas plan is not going to work there. And honestly, you may have some better pricing in North Carolina than you would Texas. That is one of the things that you will always want to keep updated on your application. Any kind of material change at all, whether it's just your phone number, if it's income, loss of a dependent, gaining a dependent, getting married, getting divorced, these are all qualifying life events that could open up a special enrollment for you to be able to change your plan. Oh, another one I forgot was a drastic change in income. So if you are making a ton of income and then July hits and for some reason you lose that income, if it changes where you're at on that federal poverty level chart substantially, it actually will open you up for an open enrollment to be able to switch your plan. Same with low income. There is right now something called a low income special enrollment that's available for people who are under 250% of the federal poverty level. They can actually change their plan all year round.
I saw we got another really good question here. So any advice about transitioning from the Affordable Care Act to Medicare? So when somebody does turn 65, and then this person specifically said, especially if each spouse is born in a different year, so different ages.
Yep, that is kind of my bread and butter. It is one of my favorite things because I think it's one of the things that scare people the most. Is like, hey, I'm 65, I'm able to go to Medicare, but my spouse is 62. We got 3 years. I don't want to work till 68 just to make sure that they have coverage. And so that's one of the things that you should consider when you're doing a health insurance advisement with anyone is what are these costs going to look like once I'm no longer on the plan? So you've told me all my Medicare costs and that's great, but what is the plan going to look like when it's just Sheila or, whatever it may be? Definitely something that you want to consider. I always try to at least do the quote for both is, hey, this is what the cost of this plan is for both of you. This is what that cost is going to be once you are removed from it, because it is going to change the advanced premium tax credits that you are eligible for. In some cases, the Affordable Care Act plan will go up in cost. And no one ever understands that one. And even me, sometimes I rack my brain, but it is just because you're no longer receiving advanced premium tax credits for the Medicare eligible person because they are moving to Medicare. And so you may have lower advanced premium tax credits calculated for the younger spouse because they are younger. So they're getting less that is calculated to them. And so sometimes we'll see that cost go up. So it is really important to plan for that when you know you'll be transitioning to Medicare.
I remember when my parents went through that and I got a bunch of questions from like, why am I having to pay more all of a sudden when like one of us is just dropping off?
Yeah.
So,
Doesn't make sense.
It
makes absolute. I wish I could make sense of any of these things some days. It absolutely makes no sense, but it is definitely something that is important to plan because sometimes it can be substantially higher. Sometimes I've seen $100 to $200 more a month once that spouse is removed, depending on the age gap. If you've got somebody who's 65 and 59, it's going to be even higher of a difference. So put that into your plan when you're speaking about Medicare and just make sure that you know, well, these are the costs that are going to be associated. And then potentially when you're enrolling for that year, look at the different plan options. Because one of the really neat things that we can actually do now with the Affordable Care Act is we can have two people on the same application using the same income, but put them on two separate plans. And so sometimes if I have somebody who is moving to Medicare, I'm going to just put them on the lowest cost bronze plan. And then I'll put them on their spouse on a plan that suits their specific needs so that there's no surprises once that person is no longer on their plan anymore. You just know, hey, theirs is going away. Yours is still going to be this cost at this rate. And it doesn't change anything up. And it makes it's really important to hammer down on this is why healthcare is so individualized. Every single person has their own story and their own needs and their own things that they're going into. So just making sure that you do talk to someone and don't try to be out here doing this on your own because there's so many different routes that you can take that aren't just cookie cutter.
That's a great point. And, just like so many things in financial planning, folks either they depend on what somebody at work told them or what their neighbor told them. And it's just totally incorrect. So it's like, if you are going to do it yourself, like make sure you do your due diligence, find out the correct answers. And if you don't want to do it yourself, work with a professional. So I think that's great advice. We got some great questions coming in. So one of the questions was, if you live on the border of two states, can you be in a plan for your neighboring state if that's where you go to the doctor? Or is it based on where your residence address is?
That is actually a really great question. So it is based on where your zip code is. And so you have to choose a plan in your zip code. However, this is one of those times where that caveat comes in because I am like that. I am in Southern Indiana. I live on the border of Kentucky and Illinois. And so people in Kentucky, there's actually a contract signed with our hospitals here so that people in Kentucky can use their health plans here because we are such a huge hub. It's very similar for like New Albany and Louisville. If you have insurance in Indiana, you can still use University of Louisville because they're a huge cancer treatment hub here for Indiana. So that's one of those things that you have to do a little bit of extra research on and just say, hey, do you have contracts with any of the carriers that are offered here in my state because we are so close to a state line? Happens a lot in like South Carolina and North Carolina. They share a lot of those situations. It's one of those things where you have to kind of figure it out on your own. But to answer the big question, you have to have a plan that's in the area in which you live. And it has to be your physical address, not your mailing address. It has to be where you actually are. But absolutely, that's a really great question.
And then the next question we've got is any advice on dental coverage? So I guess we could even tie in as well dental and vision if you want to cover that.
Yeah. My co-founder is going to get me for this, but I am such a terrible salesperson when it comes to dental and vision. If somebody has Cobra Dental and Vision, I typically recommend they at least go with Cobra Dental and Vision for the 18 months because it's so much more affordable to get dental and vision coverage through your employer than it is in the individual market. Vision, not so much. Vision is typically about $10 a person per month. Not terrible at all, but dental sometimes can be $100 a month for two people. So I really only push dental plans for someone who's like, I know I'm going to need a lot of work. I've got all kinds of major stuff, crowns and root canals and bridges and things that I have to get done. At that point, dental becomes really, really important. But if you're someone who just gets your two cleanings and just has basic things, sometimes it's better to pay out of pocket for those services than to invest in a dental plan. Don't tell my co-founder I said that. And a big thing too, I think people don't realize is you can do just dental and vision through Cobra for 18 months, even if you do not elect in health insurance. And it's usually like $30 for your family. And it's the coverage that you already have. And so you're used to it. The big thing in the individual market is it really just is. It's super expensive to have any kind of dental plans. And then you're looking at really restricted networks for the most part with what's offered in the individual market. One of the really, really important things to note as well, especially regarding vision, is that if you have anything that's related to the health of your eye, if you have cataracts or you have glaucoma or you have injured your eye, that actually falls under your health insurance. It does not fall under a vision plan. Same goes with dental. If you have an injury, if you fall and you break teeth out of your mouth and you actually have to go to a doctor, that's going to fall under your health plan and not necessarily dental or vision. Dental and vision is really just good for the materials for vision if you need to help getting your glasses and your contacts. And then with dental, it's going to be those major things like crowns and bridges and root canals.
Yeah, that's great. Great to point out those details. We had another one come in for dental that, do you have any recommendations for providers for dental coverage, or is that one of those it depends type things?
It does. There's not a ton of carriers that actually contract in the individual market. Most of the dental carriers are group, so they administer benefits through your employer or whatever it may be. In the individual market, we work the most often with, surprisingly enough, Allstate Health Solutions. Everyone always like, I didn't know Allstate did health insurance. They do, as their own separate department away from property and casualty. So if anyone's ever had a bad situation with property and casualty, their health division is absolutely amazing. They're actually who we use a lot for Medicare supplements as well. They have a ton of amazing dental plans. And the big thing with dental that a lot of people also don't realize is in the individual market, you usually have some sort of waiting period to get any kind of basic or major services done. So if you need a filling, you usually have to wait 6 months. If you need something major like crown, bridge, root canal, you have to wait a year. Allstate does not have waiting periods. They do more of a building benefit situation to where they give you a smaller percentage the first year. And then once you've been a member for an entire year, that percentage goes up, as well as how much benefit that they give you. Cannot say enough good things about them. They use Aetna's network, so a very, very well-known PPO network. Another dental company we work with a lot is United Healthcare.
That's awesome. It sounds like you've forgotten more about this stuff than Cody and I will ever know, Lyndia.
I was going to say, Lyndia, you told us ahead of time that there were very few questions that you haven't come across, and you followed through on that.
I'm going to have to start writing down the ones that come through that I'm like, oh, I've never been asked that before. Interesting question.
Like if you stump Lyndia, you get $10.
Yeah.
Yeah, honestly, like it may kind of help me be a little bit more rapid fire on this. There are so many things that I have seen. And like I said, I've been in under 65 for 7 years now. I'm about to go into my 8th year. I have learned every single thing the hard way. I have learned everything by trial and error and how not to do it, to learn how to actually do it. And I always kind of joke, well, just about the time that you think that you have it all down, they're just going to go and change it all on you anyway. So don't get too cocky with that information. So I try to stay as humble as possible because there's still so much that I don't know because there's so much to it. There absolutely is. And it never fails that I get those people like, I don't want to ask you this question because I feel stupid. I don't know, what is a deductible? How does a coinsurance work? There's no such thing as a stupid question when it comes to health insurance and Medicare because this stuff is so difficult. It is so hard to navigate and to know the ins and outs of everything. There's so many times where I'm talking to somebody on a call and I tell them something that is general knowledge to me that I've known for 7 years that just floors them. They're like, I had absolutely no idea that's how it works. One of those that we always kind of joke about is free preventive care. The Affordable Care Act says you get free colonoscopies. Unless they find something on your colonoscopy, then at that point, it is no longer a preventive action. It is an exploratory action. And so at that point, if they find something on your colonoscopy, you are then going to be billed for that entire colonoscopy. Something I learned the hard way that most people don't know. And so it's really interesting. And it's a really great opportunity to talk to as many people as I can and have these rapid fire questions sent to me because it's the best way that I learn and how to do my job as well.
Yeah. Well, that's awesome. This has been fantastic. We really appreciate your time, Lyndia. I know I learned a lot. I think all of our attendees appreciate your time as well. Can you tell a little bit more about Move Health Partners and how you work with folks? We also had a question about, do you work with people nationwide? So if you can kind of explain how you work with individuals and help them navigate this whole mess, that would be awesome.
Absolutely. So at Move Health Partners, we launched with the idea of partnering with, financial advisors, forward-thinking financial advisors who realize that healthcare planning is a huge part of your wealth and financial plan. You know, a lot of people do put off retirement for years when they don't necessarily have to, but that doesn't mean that we only work with financial advisors. I get referrals from clients all of the time who send their mother or their grandmother over to me to help with things. I am licensed pretty much nationwide. There's a handful of states that we do not license in, just because they don't necessarily license with out-of-state advisors. So places like Washington, even though we do have somebody on our team who's in Washington, there's a few niche states that I can't help in. I can still look at your coverage. I can still help guide you, even if I can't necessarily enroll a plan for you or service a plan. I am always more than happy to take a look. We also sometimes take a look if we have two different people that are retiring from two different companies and they have two different retirement plans that they need to choose from. I can absolutely take a look at those plans for you as well. It does not cost anything at all to work with me. You would pay the same cost through me that you would if you were to go to the carrier directly. Actually, in most cases, you're going to pay less because I know the loopholes and I know how to kind of navigate the options available to you, as opposed to somebody going out trying to do it on their own or going through a carrier directly. So really great question. I'm also more than happy to help anyone who needs help. I do pre-65 as well as Medicare, so I can help you transition from that pre-65 space into your Medicare space, or help with those clients who have someone who's 65 and someone who's 62. It's super easy to get in touch with me. My email is listed here, so you can shoot me over an email at any time if you need me to take a look at your plan.
Awesome. Well, we definitely appreciate your time, Lyndia. Thank you for joining us, and thanks to all the attendees. We will send out a recording of this, so give us a day or so and you'll have that recording. And yeah, just like Lyndia said, I'm always happy to help folks with whatever they need, questions, etc. There's Cody's email right there as well. So feel free to reach out to us if we can help you in any way. But other than that, thanks for coming, and we appreciate your time.
Thank you.
Take care.